So the elevated arm stress test, also known as the Roos test, is a test that we use to help identify a compressor, so someone that has their symptoms more with overhead activities. So what we're going to do is we're going to come up, we're going to pre-position our patient's arm in 90 degrees of shoulder abduction and 90 degrees of elbow flexion. We're going to be placing a downward pressure, approximately 5 pounds of pressure here, and then we're going to ask our patient to open and close their hands 1 time per second, so same speed as I'm doing. We're going to hold that for 60 seconds, looking and waiting for patient to report any symptoms. So we're going to watch the clock and we're going to mark when the symptoms occur and what they are. Roos described this as a 3-minute test, and we see a high rate of false positives at 3 minutes, so we perform this for 1 minute. Good. So to improve dorsal adduction, performing on a treatment table, our goal is for this motion, because of the convex and concave relationship, we are going to be gliding in a volar direction. So we're going to come in, we're going to stabilize the trapezium from the volar side through the web space, and then I'm going to pre-position him in dorsal adduction. Using my pisiform on the dorsal aspect of the first metacarpal, I'm going to come in and I'm going to glide in a volar, slightly proximal, slightly radial direction. I can glide and I can perform a static hold. So grade 3 or grade 4.
First, I will look at her standing alignment, checking for symmetry and posture, also checking for any swelling or bruising. Okay, can you go ahead and walk for me? And turn. And come on back. Good. Now can you go have a seat on the table with your legs straight and your feet off the edge? Now I will look at her resting alignment, again checking for symmetry, swelling, and any bruising. Okay, now I'm going to have you do some motions. You tell me if there's any pain. Can you bring your ankle up and point it down and relax and twist in and twist out and relax. And now your big toe, can you bring it up and then point it down? Good. Now I'm going to take you through some motions. You tell me if there's any pain. Up, down, in, out, and your big toe up, down. Now I'm going to press on a few spots around your foot and ankle. You tell me if there's any pain. Here?
No.
Here?
No.
Here?
No.
What about along here?
No.
Right here?
No.
Okay. What about right here?
No.
Across here?
No.
Along here?
No.
And underneath? Any pain along here?
No.
What about along here?
No.
Okay. Now I'm going to go ahead and check stability of your ankle. You tell me if you have any pain. Now I'm going to do a few additional tests. You tell me if there's any pain. If I squeeze here.
No.
Okay. If I bring your big toe up like this, or if I add additional pressure here.
No.
Okay. Now would you please lay on your belly with your feet off the edge of the table? Good. And relax this leg. Any symptoms if I squeeze here?
No.
Good.
Hello, Mr. Parker. I'm Dr. Bleaswell. Thank you for letting me examine you today. Thanks.
Okay.
What I'm going to do first, I'm just going to put this pillow under your hands, if that's all right, and I'm just going to roll these up. just going to put this down for a sec. Right, what I'd like you to do is just lift your hands up for me. Make a fist. Turn them over. Straighten them out. Put your hands together, elbows up. Other way round. Elbows up like this. Straighten your arms right out, up behind your head and behind your back. Thank you. And then put them back on the pillow. I'm going to have a feel of your joints now. Let me know whether any of them are tender at all. Let me know whether any of them are tender at all. Is that sore?
No.
Is that sore?
No.
Is that sore?
No.
Is that sore?
No.
Just turn your hands over for me. Just turn your hands back again for me. Now what I want you to do are some activities. Can you first of all squeeze my fingers as hard as possible? Good, that's fine. Make an O with your finger like this. And then with your little finger. Now I'm going to give you a jar. Which, are you left or right-handed?
I'm right-handed.
Take this jar in your left hand, undo the lid. Take the key out and just pretend this is a lock and turning it. Okay, excellent. Put it back in the jar. And now can you change hands and put the lid on with the other hand? Thank you. Just going to take your blood pressure. Let's put your arm through there.
Sorry.
Blood pressure was 130 on 80. Now what I want you to do is put your arms up like this and keep them up as strong as you can. Okay, that's excellent. Put them in and keep them in. Okay. Now just going to have a look at your face. Just open up your mouth for me. And lift your tongue up. Just leave it open. I've got a glass of water here. I just want you to take a sip for me. Thank you. Let's get you to lie down. I'm going to put the pillow here. Lie down flat on the pillow. I'm just going to pull this down. Take a deep breath in and hold it. And take a deep breath out and hold it. Just sit up for me. Just take some deep breaths in and out. Lie back on the bed. I'm just going to have a look at your lower legs. I'd like to complete my examination by feeling for hepatosplenomegaly, fundoscopy for hypertensive changes or papilledema, and examining the urine for blood or protein. Thank you very much, Mr. Parker.
Thank you.
At the moment, I'm just applying that, and then I'm going to do a slightly deeper sweep across the eyebrows. You can either do both together, particularly when you're just warming up, you're just starting it. You can see it's enough to move the skin, but I'm not pressing too deeply. It's a very delicate area. I'm being very careful that I don't come forward onto the eyes. You will feel the eye socket there, so you're very much following that. Particularly if you're working with a lady who might have had eyebrows either tattooed on or has plucked eyebrows to almost non-existence, you'll have to feel for the eye socket. You can't go by where the eyebrows are. Sometimes where the eyebrows are isn't naturally where the eyebrows would be. So feel for the eye socket and you're working along that. You can see I'm just sliding along to begin with. You can then, I'm going to kind of anchor this eyebrow here. I'm going to press and release all the way along. It's surprising how tender the eyebrows can be in someone who has got TMJ problems or who's gritting and grinding their teeth. And I'm bringing that all the way out to in front of the ear. And I'm going to repeat it on the other side. You may not be able to see this as easily, but you can see how I'm just anchoring with that first thumb and working my way across. It's just a few millimeters at a time that I'm working. When I get to the temple, I'm just gliding. I'll show you again on this side. So I'm working across just a few millimeters at a time. But as I get out towards the temple, I'm not putting any pressure on, I'm just gliding out towards the ear. You're then going to use your 3 middle fingers, and we're working all the area in front of the ear. So in front of the ear and above the jaw. And you'll start to feel when you get to here, you can feel the jaw joint that we're going to come back to. We're working up until we get to the auricularis superior, which is the thin fan-shaped muscle. And I'm slowly circling. I'm going to come in both directions. So you can either work up all together in one direction, right across, and then come back and work in the other direction. Or you can just